My name is Mushtaque Chowdhury. I'm from Bangladesh. I used to work for BRAC, which is the largest NGO. I was the vice chairman of that. Currently, I am a member of the Board of Trustees of BRAC University, and I also teach at Columbia University in New York. One of the reasons why Bangladesh has done very well is the expansion of the rural health infrastructures. For even 6,000 population, Bangladesh has created what we call the community clinics. So there are about 13,000 community clinics in Bangladesh for a population of 160 million. So Bangladesh has one of the densest health facilities in the country. So that's one thing which has happened. Secondly, the public health actions, I was talking about the ORT and family planning and also immunization. So Bangladesh has done quite well in all these public health actions that lead to improvement in health status. As I said, that Bangladesh has a very sort of thriving pharmaceutical industry. When Bangladesh became independent, there are only two small pharmaceutical factories in the entire country, but now there are hundreds of them, and many of them are really big and state of the art things are there. Many of the drugs that are produced by Bangladeshi companies are also licensed in many of the Western countries, and it meets over 95% of the domestic needs, and also it is exported, as I said earlier, to over 100 countries. Bangladesh is really looking forward to expanding that sector to even bigger and bigger. One of the challenges that the country is facing is making the healthcare affordable to the people. And people are talking about universal health coverage, which means that everyone, everywhere, has to have quality healthcare at affordable prices. So that's the big challenge that Bangladesh is having, how to ensure that. Unfortunately, Bangladesh government spends very little on healthcare, which is probably the second lowest in the world. But with this investment, it is not possible to go much further. So what is needed is more investment in healthcare, but just having money is not going to be enough for the future. We have to improve the healthcare delivery, the access to healthcare, the quality of care that is being there, and we haven't really done well in ensuring that. Moreover, the private sector has also grown very much in the country, and that's, on the one hand, is responsible for bringing more healthcare to the people, but at the same time there are questions about the quality and the regulation of the private sector. We know that it's one of the reasons for reduction in maternal mortality is the availability of this private care. But at the same time, if you look at the cesarean sections, about 80% of the cesarean sections are done in the private sector, and that's related to profit making. So this is one of the major challenges, how the government is going to really regulate the private sector. The only regulatory law that is available was drafted in 1982, but the world has moved so much over the years, but we haven't really updated that particular law which regulates the private sector. So we have to really work on that in order to make the private sector more contributing to the good health of the the citizens. Bangladesh and India, we have our common past. There are so much similarities in culture and the traditions and so on. I feel that there are many opportunities for us to work together, particularly in the healthcare. Innovations have been done both in Bangladesh and also in India. But there hasn't been much of a interaction with respect to exchanging ideas, exchanging experiences. So having those sort of exchanges would help both the countries in really taking the healthcare sector further and further. India has been one of the popular destinations for Bangladeshis to come for better healthcare, for surgeries and other things. And people are happy to be here in whether it is in Chennai or Delhi or Kolkata or even Hyderabad and so on. The kind of care they get, I am told that people are very happy about the nursing care that are done, and also of course the surgeries that are done, and people are very happy. The other good thing about India compared to Singapore or Bangkok is that it is much cheaper compared to those countries, and some say that in some instances it is cheaper than Bangladesh itself. So India offers those kind of opportunities for Bangladeshis to come and sort of for treatment.